when behaviour support practitioner may help. Behaviour support may help when behaviours of concern affect safety, routines, relationships, or daily life. Emotional distress is happening often. Support workers are unsure how to respond. Family routines feel disrupted. Communication needs are unclear. Behaviours are placing someone at risk. Restrictive practices are being used or considered. What makes a good behaviour? Support practitioner. A good practitioner looks beyond behaviour and focuses on the person's needs, goals, and dignity. Person-centred approach. Trauma-informed practice. Clear communication. Strong assessment skills. Practical daily life strategies. Respectful, non-judgmental language. Collaboration with families and support teams. Check their NDIS suitability, experience and registration. Before choosing a provider, ask whether the practitioner has the right background and NDIS behaviour support experience. Ask about NDIS suitability. Check specialist behaviour support registration. Ask about similar participant experience. Confirm behaviour support plan experience. Ask about restrictive practice knowledge. Check how they meet safeguarding expectations. Questions to ask before choosing a practitioner. The right questions can help you choose a practitioner who fits the participant's needs and support goals. How do you involve the participant? Do you complete functional behaviour assessments? How do you work with families and carers? How do you make strategies practical? How often do you review progress? What are your fees and billing practices? Look for person-centred support. Behaviour support should feel respectful, safe and focused on the person behind the behaviour. Behaviour is often communication. Support should not blame the participant. Emotional safety matters. Trust and choice are important. Sensory and communication needs should be considered. Strategies should support dignity and well-being. Understanding the behaviour. Support assessment process. A good assessment helps the practitioner understand the participant's life before developing a behaviour support plan. Initial conversation. Information gathering, observation in daily settings. Functional behaviour assessment. Practical strategy, development behaviour, support plan creation, support team guidance and review. What should an NDIS behaviour support plan include? A behaviour support plan should be clear, practical and tailored to the participant's real life. Strengths, goals and preferences. Communication style and support needs, behaviours of concern and triggers. Early warning signs, proactive strategies, skill building supports, safe response strategies, review arrangements. A good behaviour. Support plan should be easy for families, carers and support workers to understand and practical enough to use in real daily situations. How NDIS funding may support. Behaviour support may be funded when it connects to the participant's disability needs, goals and approved supports. Check the participant's NDIS plan. Look for relevant capacity building funding. Review plan, wording carefully, confirm service agreement details, ask about fees and claiming. Speak with a support coordinator or plan manager. Red flags to watch for in a support practitioner. Not every practitioner will be the right fit, so it is okay to ask questions and compare providers. They do not involve the participant. They only focus on stopping behaviour. They use generic strategies. Fees are unclear. They do not review the plan. They use blaming language. They lack restrictive practice knowledge. A good practitioner should make the participant and family feel heard, respected and informed, not blamed, rushed or confused. Choosing the right fit for the participant. The participant should feel respected, heard and included in decisions about their support. Communication should be clear, calm and easy for families and support teams to understand. Strategies should feel practical and realistic for the participants' daily routines. Families, carers and support workers should feel informed, supported and confident using the plan. Behaviour. Support for different participant needs. Every participant is different, so behaviour support should never be one size fits all. Autism support may consider sensory needs. Children may need family-centred strategies. Adults should have choice and dignity. Psychosocial disability support should be trauma-informed. Strategies should match real routines. Support should respect identity and communication style. How Affective Care can support. Affective Care provides emotionally centred NDIS support that focuses on the person behind the behaviour. We offer calm and respectful approach, participant-led support, focus on trust and dignity, practical strategies for daily life, support for families and carers, Emotionally intelligent. NDIS care guidance with behaviour support options. Choosing support that feels right for the participant. Choosing the right support means finding a practitioner who listens, respects the participant's goals, and creates practical strategies for daily life. The support should be person-centred, trauma-informed, and practical for the participant's everyday life. With the right fit, behaviour support can feel safer, calmer, and more connected.